Managing diabetes isn't just about counting carbs or injecting insulin. It's also about making sure your body has the right vitamins and minerals it needs to function well. Blood sugar swings, nerve damage, slow wound healing, and immune dysfunction are all part of the complex puzzle of diabetes, and inadequate nutrient levels can make every complication worse. To help you stay on top of your health, here are 7 critical vitamins and minerals that research shows can make a real difference in blood sugar control, nerve and immune function, wound healing, and overall well-being when you have diabetes. Each one plays a unique role, and correcting any deficiency can ease symptoms, improve your quality of life, and reduce your risk of long-term complications. Vitamin D is often called the sunshine vitamin, but people with diabetes are notoriously prone to low levels. You might wake up feeling exhausted, experience muscle weakness that makes everyday tasks a struggle, or notice frequent bone or joint pain and an increased risk of fractures. Your immune system may also feel sluggish, getting sick more often, or taking longer to recover, and you could find nerve pain or tingling in your hands and feet worsening. High blood sugar also interferes with vitamin D's ability to regulate insulin production and sensitivity in the pancreas, making glucose control even more challenging. All these signs point to one guilty culprit: a lack of active vitamin D, which your kidneys normally convert into its hormonal form. But when diabetes damages those kidneys, a condition called diabetic nephropathy, your ability to activate vitamin D diminishes. Carrying excess weight compounds the issue, since body fat stores vitamin D and prevents it from circulating in your bloodstream. Limited sun exposure, poor dietary intake, and chronic inflammation, all too common in diabetes, only deepen the shortfall. Without enough vitamin D, inflammation runs unchecked, blood vessels stiffen, blood pressure can climb, and your risk of heart disease, kidney damage, nerve pain, and vision loss from retinopathy all go up. The fix is straightforward. Aim for 15-30 minutes of morning sun exposure a few times a week, focusing on arms and legs without sunscreen. Then incorporate fatty fish such as salmon and mackerel, UV-exposed mushrooms, egg yolks, and fortified dairy or plant milks into your diet. Most people with diabetes need at least 1,000–2,000 IU of vitamin D3 daily, and your doctor may prescribe even higher doses if your levels are severely low. Don't forget to add magnesium-rich foods like spinach and almonds, since magnesium is required for vitamin D activation. Finally, get your vitamin D levels checked every 6 months so you can adjust your intake and keep inflammation, blood sugar, and infection risk under control. Thiamine, or vitamin B1, is a critical cofactor in glucose metabolism, and yet many people with diabetes are deficient without realizing it. Because high blood sugar causes frequent urination, you can lose thiamine in urine faster than you replace it. On top of that, poor dietary intake of whole grains, nuts, and legumes and gut issues common in diabetes further diminish absorption. A lack of thiamine shows up as general fatigue, muscle weakness, numbness, or tingling in hands and feet, blurred vision, irregular heartbeats, fluid retention in the legs, loss of appetite, and even mental fog or irritability. In severe cases, it can lead to the potentially fatal wet beriberi syndrome, characterized by heart failure and edema. Thiamine is essential for breaking down glucose into energy, regulating nerve function, and promoting heart and kidney health. Without enough of it, insulin resistance worsens, nerve damage accelerates, kidney function declines, and wounds, especially foot ulcers, heal more slowly. The solution? First, prioritize whole grains such as brown rice, oats, and bran, nuts, and seeds like sunflower seeds and almonds, beans and lentils, and fortified cereals. If dietary changes aren't enough, discuss thiamine supplementation with your doctor. Typical doses range from 50 to 100 mg per day, but should always be guided by blood testing. Controlling blood sugar is also key. Lower glucose levels mean less urinary loss of thiamine. Finally, antioxidants from berries and leafy greens help protect existing thiamine stores by reducing oxidative stress, giving your nerves, heart, and kidneys the support they need. Vitamin B12 is crucial for the health of your nerves, red blood cells, and brain. But it's ridiculously common for people over 60 with diabetes to have low B12 levels. Long-term use of metformin, poor stomach acid production, or compromised gut health can impede your body's ability to absorb this water-soluble vitamin from food. Symptoms often creep in slowly: fatigue, weakness, numbness, or tingling in feet and hands, balance issues, palpitations, pale skin from anemia, and cognitive changes like memory loss, confusion, or brain fog. Left uncorrected, B12 deficiency can cause irreversible nerve damage and worsen diabetic neuropathy, increase homocysteine levels that harm cardiovascular health, and delay wound healing, dangerous for anyone at risk of foot ulcers. To correct, start by adding more B12-rich foods, lean meats, fish, eggs, and dairy. Vegans can turn to fortified plant milks and cereals. But because absorption declines with age and diabetes, oral supplements of methylcobalamin or cyanocobalamin, $500, $1,000 mcg daily, are often necessary. For severe deficiency, your doctor may recommend B12 injections. Regular screening for B12 levels, especially if you're on metformin, is critical. Restoring adequate B12 can lift your energy, sharpen your mind, and protect against nerve and heart complications. Vitamin C isn't just an immune booster. It's also vital for maintaining healthy blood vessels, skin, and wound healing. Diabetics tend to have lower vitamin C levels because high blood sugar competes with vitamin C for entry into cells via the GLUT1 transporter, and chronic inflammation and oxidative stress use up vitamin C stores rapidly. A deficiency can manifest as non-stop fatigue, slow-healing cuts or foot ulcers, bruising easily, dry or rough skin, bleeding gums, joint pain, and even iron deficiency anemia, complications that mirror diabetes itself. Without enough vitamin C, collagen production falters, blood vessels weaken, and your body struggles to ward off infections and repair damaged tissues. To reverse a deficiency, load up on non-starchy fruits and veggies, bell peppers, broccoli, strawberries, kiwi, and citrus fruits. If you can't meet your needs through diet alone, ask your doctor about a daily 500 to 1000 mmol vitamin C supplement, split into 2 doses to improve absorption, and always pair it with meals to reduce digestive discomfort. Tighter blood sugar. Control will also help preserve vitamin C levels by reducing competition for cellular uptake and lowering oxidative stress. Vitamin E is a fat-soluble antioxidant that safeguards cell membranes, nerves, and blood vessels from oxidative damage. In people with diabetes, increased free radical production and chronic inflammation rapidly deplete vitamin E, leaving you vulnerable to muscle weakness, vision problems, especially night vision, numbness or tingling in the extremities, fatigue, and even heart rhythm abnormalities. Because vitamin E must be absorbed with dietary fat, issues like gastroparesis or low-fat diets can further impede uptake. Over time, low vitamin E exacerbates neuropathy, retinopathy, and cardiovascular risk. To boost levels, include vitamin E-rich foods such as nuts, almonds, hazelnuts, seeds, sunflower, pumpkin, spinach, broccoli, and healthy oils, olive oil, sunflower oil. If diet falls short, discuss a supplement providing 15 mg, 22.4 IU, of mixed tocopherols daily, but avoid megadoses unless under medical supervision, as excess vitamin E can interfere with blood clotting. Keeping blood sugar stable will reduce the oxidative burden on your vitamin E reserves, making these foods and supplements more effective. Magnesium is a master mineral that supports over 300 enzyme reactions, including those involved in blood sugar regulation, nerve transmission, muscle contraction, and bone health. Diabetics often lose magnesium through urine due to hyperglycemia, and many diabetes medications, particularly diuretics, further deplete magnesium stores. Symptoms of deficiency include muscle cramps or twitching, persistent fatigue, anxiety, or irritability, sleep disturbances, irregular heartbeat, and even insulin resistance. Low magnesium makes it harder to manage blood sugar, raises blood pressure, and worsens neuropathy and osteoporosis risk. To restore magnesium, eat plenty of leafy greens, spinach, Swiss chard, nuts, almonds, cashews, seeds, pumpkin, chia, whole grains, quinoa, brown rice, and fatty fish, salmon. If dietary intake isn't enough, a supplement of 200 to 400 milliliters of magnesium citrate, glycinate, or malate daily can help. Just start low and increase gradually to avoid digestive upset. Regular monitoring of serum magnesium and tight glucose control will ensure you rebuild your stores and reap benefits from better sleep, fewer cramps, calmer nerves, and improved insulin sensitivity. Zinc is an essential trace mineral that plays roles in insulin production, immune defense, wound healing, and cellular repair. Diabetics often lose zinc through frequent urination and may have poorer absorption due to gut issues or high blood sugar levels. Signs of low zinc include slow wound healing, especially dangerous if you have foot ulcers, frequent infections, poor appetite, changes in taste, skin rashes, hair thinning, fatigue, and worsening neuropathy symptoms. Zinc deficiency can impair insulin secretion and heighten oxidative stress, making blood sugar harder to control and complications more likely.